Any doctor will tell you that checking cholesterol is a critical step in preventing heart disease and other serious health problems. But despite millions of people living with high cholesterol in this country, many have still not had their numbers checked. CTV medical expert Dr. Marla Shapiro is here now to talk more about cholesterol, the good, the bad, and what you should be looking for.
Right.
Thank you very much for joining us today.
So cholesterol is essential for us. It's a building block. It's a fatty lipid, and it's important for hormone development, our cell membrane development, and it's made by our liver. Some people make excess because they have a genetic predisposition. Our diet's important because cholesterol is seen in high-fat dairy, it's seen in meat products. So often we're unaware about how much we're ingesting. So we need a certain amount to make sure that we're healthy, but too much of it becomes an issue and a risk factor for numerous things, as you mentioned, heart disease, stroke, atherosclerosis, developing plaques in our vessels that lead to no good ultimately.
And there's the good cholesterol and the bad cholesterol.
Yes.
HDL is the good, LDL is the bad. Right?
And it's not quite that simple. People will say, what's my cholesterol number? It's not the overall number, it's the ratio of the good to the bad. As you mentioned, HDL is good cholesterol, high density lipoprotein. That's what that H stands for. And we're learning, though, that a high-density lipoprotein is protected because it drags away some of the bad cholesterol, but too much of that can be an issue as well. The low-density lipoproteins, the very low-density lipoproteins called LDL, VLDL, and then anything that's not HDL are all the so-called bad cholesterol. And if you have too much of that, and it depends how much of each, those are smaller, and they can settle into the vessels. They can lead to plaques in those vessels, and it's the plaques in the arteries that we really worry about.
And what are good numbers for both? And are there signs? Do we know, other than getting blood tests, are there anything that will indicate that we might have issues with it?
So a blood test is the basic way to find out. And there's no simple answer in terms of what should our numbers be. For example, if you're a diabetic, we really want the LDL to be quite low. If you're at risk for heart attack, primary prevention, we want the LDL to be low. If you have had a heart attack or had a stroke, then we really want to drive the LDL so low, no too low is considered too low, and that usually has to be done by medication.
And too high? What are some of the, even with the HDL?
Yeah, you won't necessarily be aware of any symptoms because the development of atherosclerosis and those plaques are silent until you have an event. So what's an event? A plaque can rupture, leading to a heart attack. A plaque can rupture from a vessel and travel and give you a stroke, cardiovascular event, a transient ischemic attack. So often you don't have any awareness that your cholesterol is high until you have end organ damage. So it really becomes important to know when should I be screened and what should my numbers be, and what your numbers are going to be is really going to depend on what your basic risk factors are. For example, if you're a smoker, that's going to be an additional risk factor. Family history, we're going to enter that into the equation. So it really is part of individualized medicine to decide, is the value that I'm getting in terms of the LDL, the HDL, the ratios, the range that I personally should be in.
Now, and getting tested, I had my first test in probably about 4 or 5 years because of the pandemic, and I think a lot of people are probably in a situation. I'm lucky because genetics, I have some pretty good numbers for it.
Yeah.
But you should be getting tested, and especially with what's gone on, a lot of medical issues have kind of gone by the wayside.
Absolutely. And Canadian guidelines are a little bit different than American guidelines. You know, in Canadian guidelines, we really talk about all men over 40, all women over the age of 50. The American guidelines say if you have a family history that's really suggestive of risk, you should do it younger, even above age 2 or so. There are diseases called familial hyperlipidemia where you inherit that gene. That's a little bit different than the average population. And it's part of a routine screening. For example, if you're diabetic, you're going to do it earlier. If you're hypertensive, you're going to do it earlier. If you have a big waist circumference, that is going to be an issue as well, which is going to tell us we should be screening for additional risk factors, of which a simple blood test that will tell you all the subparticles of the overall cholesterol molecule can be given to us.
Now, the good news is for most people, probably you can lower them by how you eat and what you do.
No question.
And when do you decide you should be on meds, though?
Well, again, it's going to depend on what your individual risk factors are. So, you know, universally, many diabetics are on medications because we know diabetes is such a risk factor for heart disease. If you've had a cardiovascular event, you're likely going to be on medication. If you're too high, even for the general population, and we have ranges of what we consider normative values, we'll first have the discussion about diet and lifestyle. So what you eat, Be a label reader. You know, we do ingest cholesterol. Are you doing high-fat dairy? Can you lower it to lower-fat dairy? Look at whether you're looking at monosaturated fats, polysaturated fats, or the terrible trans fats. How often do you eat out? Are you aware of what you're actually doing in terms of your lifestyle? So exercise, all of that is critical first steps. And then you have to really look at your numbers individualized with your overall health picture and have that one-on-one discussion. Do you need medication or not?
All right, Dr. Shapiro, thank you as always.